Where do I find a list of Medicare Advantage Part B drugs? Well, let's talk about that in just a minute. Hi, I'm Bob Vineyard, your Medicare expert with the Georgia Medicare Minute. This is a question that hardly ever comes up, at least not in that form, but I will get questions from time to time where people will call me up and they'll say, well, I've got a friend that also has Medicare and they don't pay hardly anything for their drugs. They're covered by Medicare. Why am I paying so much? Well, could be a number of reasons. Most often the reason is you have a Medicare Advantage plan and your friend has original Medicare. Well, let's talk for a moment. Under original Medicare, there are certain classes of drugs. Generally, it's chemotherapy. There's a few other medical conditions. I think hemophilia is one of them where you can get injections in a doctor's office or a clinic. And there's also insulin, and we'll talk a little bit more about that in a minute. But there's a few situations where original Medicare will cover certain drugs under Medicare Part B, which means that you have an outpatient deductible. After that deductible satisfied, Medicare pays 80% and you're responsible for the other 20%, unless of course you have a Medicare supplement plan, particularly Plan F or Plan G, in which case you don't even pay the 20%. So your responsibility is the Medicare Part B deductible or less. Now, what are Part B drugs? Well, I've already mentioned a lot of them are chemotherapy, some of them, and insulin also falls in that. If you are an insulin-dependent diabetic and you have a pump. So in those situations, your insulin can be covered under Medicare Part B as opposed to your Part D drug plan, which means that instead of paying $300, $400, $500 a month for your insulin, well, you satisfy your annual Part B deductible, and then Medicare and your supplement plan, if you have F or G, pays the balance of it. So your out-of-pocket is a lot less under those situations if you're an insulin-dependent diabetic and you have a pump. The general rule for covering drugs under Part B, Medicare Part B, with exception of the insulin, which is self-administered by way of a pump. But the general rule is if you are receiving a medication, either in a doctor's office or a clinic, this is not a self-injected type thing, a professional is administering the drug, then those drugs are normally covered under Medicare Part B. Now, if you have a Medicare Advantage plan, there is no such thing as Medicare Part B drugs. All of your drugs will fall under the drug plan portion of your Medicare Advantage plan, which is in essence a Part D type of coverage. But again, it's folded into your Medicare Advantage plan. In most cases, there's a few Advantage plans out there that do not include a drug plan, and you have to go secure one somewhere. But even if that's the case, even if you have one of those Advantage plans that does not have a drug plan baked into it, and you need some of these normally Part B drugs, well, they're not going to be covered under your Advantage plan. They're going to fall under Part D. Which brings us to another issue, the Medicare Advantage plans. Most of the Advantage plans have an out-of-pocket cap of $6,700 per year. Well, that's pretty steep. But keep in mind that out-of-pocket limit only applies to in-network approved charges for health care. Let me repeat that. It only applies to in-network approved charges for health care, not prescription drugs, because there is no prescription drug benefit that is, there's no prescription, there's no Part B prescription benefit that is included in Medicare Advantage plans. So, if you're looking at an Advantage plan, and particularly if you're an insulin-dependent diabetic with a pump, you might want to reconsider and look at original Medicare plus a supplement plan, unless you just don't have a problem paying $300, $400, $500 a month for your insulin, or if you should need chemotherapy or some other type of drug that's administered in an outpatient setting by a professional, then maybe you shouldn't have an Advantage plan. Now, granted, a lot of people are in relatively good health when they originally go on Medicare, and they think, well, I'll never get sick. I've never been sick. I'm not going to get sick. So why do I need to pay for something that I'm not going to use? Well, it's a good point. It's a valid question. Problem is, we never know when we're going to get sick. Is it going to be 6 months after we go on Medicare? Is it going to be 6 weeks after we go on Medicare? Is it going to be 6 years or 16 years? We just never know. Even if you and your family typically have had good health and longevity, there's always accidents. Accidents are something that nobody can predict. That's why they're called accidents. So, anyway, this brings us back. I'm kind of wandering here. Let's bring it back to the Medicare Part B drugs, which only applies to original Medicare, not Medicare Advantage plans. Keep that in mind. Most people don't know this. Share this video with your friends. Some of them might be surprised too. This is Bob Vineyard, your Georgia Medicare expert with the Medicare Minute. You take care. Have a great day.